My name is Stephen Cox. I'm an optometrist in Uvalde, Texas. Uvalde is a community of about 30,000 people, about 90 miles west of San Antonio. My brother Chad is also on the call. He's the one driving the slides. He's a computer programmer in Wichita, Kansas. We are the co-founders of Appointment Launch. First of all, we'd like to thank Redox for organizing this meeting. What I've seen so far is already game-changing, and we're just honored to be part of this, and we hope we can make a difference. Our goal with this software is to hopefully make it to where it'll improve the safety of your providers and your patients when they see patients. My office, did a little bit about me, consists of 3 full-time optometrists who live in town, and then I've got 3 ophthalmologists who travel from San Antonio 90 miles to see patients in my office. My office is still partially open. We are no longer seeing routine exams or performing any cataract surgery or LASIK. We still see urgent and emergency cases. The last thing we want to do is have preventable blindness during this time. We can see some of those patients, in fact, a fair amount of those patients with telemedicine. I just did one a few minutes ago, but some of our patients have to be seen in the office itself. So Appointment Launch was originally a patient experience software. Chad, if you'll change slide, there we go. At Appointment Launch, we streamline appointment workflows and help communicate the messages you want to send to your patients before, during, and after their exam. What we're presenting today, though, is a module that we've redesigned over the last few days to see patients as safely as possible during this crisis. Go ahead. So our biggest concern during this healthcare crisis is COVID-19, and other urgent and chronic healthcare needs continue every day, though. The visit to the healthcare provider's office has to change dramatically now that this virus is present. So in the past, a typical visit to a healthcare office consists of checking in at an appointment desk, handing the receptionist an insurance card, filling out and signing paperwork that's on a clipboard, and then sitting in a waiting room with other patients to be called. Once in the examination room, an assistant finds out the reason for the visit, asks the current medication, and asks how the patient is feeling today. The healthcare provider then enters the exam room, examines the patient, explains the diagnosis and treatment, and then often gives them a handwritten paper about their condition. The way we perform all of these actions must change today because of COVID-19. So how do we change the office visit? First, we get rid of the clipboard. How is this helpful? First of all, the clipboard is outdated, and patients don't want to sit in a waiting room putting their name on every form anyway. They don't remember what medication they're on or how to spell it or how much they take. More importantly, any amount of time in a waiting room with other patients is a potential time to contract or spread COVID-19 and other conditions. Why can't a patient do all this at home where they have all the information and time they need? Why not make it electronic so they can save and reuse the same information again the next time they come in for an appointment at your office or even to other doctors' offices? So how does this all work? It starts with an appointment. Let's look at Sally. Sally calls your office. She's triaged by scheduling, and an appointment is made. Sally receives a text message and an email as soon as her appointment is entered in your system. Sally clicks on her text message and is sent to the Appointment Launch progressive web application. She verifies her contact information and sets up an account. Appointment Launch pulls the appointment and demographic information from your EHR. Sally confirms her appointment in Appointment Launch. Sally can add the appointment to her calendar with the click of a button. She details her reason for the visit. She verifies her demographic, billing, insurance information. She takes a picture of her insurance card. She adds her current medications, insurance information, pharmacy, medical history, social history, allergies, and any other providers. Any additional custom questions can be set up as well. Custom forms like financial, privacy policies, and permission to use telemedicine, which becomes big right now, can be completed and signed through Appointment Launch. Sally can go through and complete each task at her convenience. The requested forms may be tailored by the appointment type as well. So when her appointment time comes, she checks in virtually. The receptionist confirms that all the tasks that we've asked her to do have been completed. More tasks, such as a review of systems, can be added at check-in. The copay for Sally's visit is collected electronically through the appointment launch. My brother-in-law is an internal medicine physician in San Antonio, and they've been able to do quite a few patients with telemedicine right now, but they weren't collecting copays. They weren't having the patients sign any documents, and they've really been struggling. And so we're going to be working with them with this new module of our software, and we hope we can really help them tremendously. So moving on with patient flow, the patient encounter then may be a private phone call or a video chat through appointment launch. If the visit can be completed through telemedicine, then the remainder of the exam and billing is completed through the provider's EHR system. If an additional in-person visit is needed, then an additional appointment is made. If an in-person office visit is still needed, no additional paperwork is needed. So we've already done a large amount of things through telemedicine, and really all they have to do is come in and the room's ready for them, and we can expedite the amount of time that patients are in the exam lane. So she can send a message through appointment launch that she's arrived. She can wait in her car and it's time for her to be seen. She will receive a message when the provider is ready and will be taken immediately back for the completion of her examination. She can also be evaluated in her car if indicated, and I know several offices that are doing that right now. So through appointment launch, our hope is that we can significantly reduce the amount of face-to-face time needed to evaluate patients during this time. And we appreciate your time. Thank you.